represented India at the United Nations on Settlement and served as country's representative for agricultural negotiations at the World Trade Organization, Geneva, for 3 years, where he also chaired the Committee on Technical Barriers to Trade. Notably, he was the lead negotiator for India-Australia Free Trade Agreement, signed in March 2022. So we are definitely looking for you to push for our needs and negotiate. Aradhya, please join us.
Good afternoon and thank you. In the broader, this is a very limited sector, but his span is much bigger. And he's always full of ideas, full of energies, and he's the person who's rooted to the ground. So you would like to visit, see the condition at the site before he moves on. Also, the stage, Mr. Karan Suli is there, Mr. Rana Mehta is there, Mr. Rajendra is there. All of them have, and we've heard some of the three of them with regard to what is happening on the senior citizen sector, what is happening on the aging population of the country. Presently, with the presence of roughly 150 million people, what we are looking at in the next 20-25 years, it will be around just more than double of that. And that is something which is engaging the government. That is something which we are working on various aspects. One of the aspects is what ASLI is representing. ASLI is representing the senior living, senior care part of one part of that. But it's a bigger spectrum which we are looking for, and from the government perspective. And some of them was also touched by Mr. Mehta when he talked about the healthcare sector. Healthcare sector is, and as has been rightly pointed out, with advances in modern science and technology, the longevity has gone up. People live for a longer period of time, and with it, there are challenges. You can live with the technology and sciences, medicines and interventions and so on and so forth. But the body ages and different people have different situations. And then you would require what was talked about the healthcare ecosystem, within the healthcare ecosystem. One part is these services being provided by the hospitals, the health professionals. But it goes beyond that. You go for an intervention in the hospital, you come back, and then you operationally require various services. You may be at home, but you require healthcare. You may have a mental challenge, and you may have dementia, as was also pointed out. So it's a span of various things. It's not only physical, it is mental also, it's also emotional. All of those are the challenges as we age. Someone may require it at the age of 70, someone may require it at the age of 80, and when you're talking even beyond 90. People do live longer than that, and they require those special interventions. The other part which is there is the economic part of it. The healthcare part is not part of it, the economic part of it. There are various sub-professions, you never retire, but a number of organized services, there is a definite retirement age. When you retire, you may still be productive, you may be physically, mentally active. How can you contribute to the society? This is the other part which we need to look into, and how what was called as silver economy, how that can be your knowledge, your wisdom, your gained experience, and all of that is something which we need to, how that can be much more channeled, and how we can provide the right kind of support system and ecosystem, and how we can connect people. Someone just wants to be a mentor because of the experience of decades, not in a manner of only earning, but also being useful to the society. That would require that how do you connect with others who would require such similar kinds of services or consulting or mentorship. So there are various ways without other than just being sitting at home. The other is obviously the loneliness part of it, and how we tackle loneliness, create urban areas, in urban areas, and the loneliness part of it, whether it's senior citizen homes, where we are, which may be different from daycare or a day center in urban areas, municipal areas, where you can come in, you can just sit in, interact, talk to people, because loneliness is a very challenging situation as we age, and especially when nuclear families in urban areas are increasing. So that's the other part. So that's how do we ensure that this social inclusion, that is also one part of the policy. The other is the safety and security. Safety and security goes through all of us hear about the cyber security and this financial security part of it. And also, it's just the physical security is also sometimes important, especially when you're living alone. So that is also part of the policy which we need to address. Various states are doing that, and as a government we have certain things. But it's, I think so the most important thing is government will put out a policy. The states will also put out policies. They can bring in some infrastructure, support the healthcare and so on and so forth. But there's a lot to come from the private sector, from the society, from citizens, in this overall dynamics of the issues and challenges a senior citizen would have. And as I said, it's beyond healthcare, and health is as healthcare, the socially and loneliness is there, then getting something. And then we have these other challenges. What we look from a rural perspective would be totally different from what we look at from the urban perspective. People who are living in rural areas may have a challenge of good access and availability of healthcare professionals, and with that kind of specialized general primary healthcare, maybe that much, but with the kind of advanced age, you will require a different kind of health intervention, which will not be available in rural areas. The accessibility part of it, the affordability part of the healthcare is a big thing. The government has done very, and Dr. Paul was one of the leading who pushed that to ensure that everyone before, beyond the age of 70 gets covered under the Ayushman card and the Ayushman scheme. So irrespective of whether you are rich, poor, and so on and so forth, you can be covered under the health insurance coverage beyond 70. And we know, I think, more than if I'm not mistaken, more than 1 crore people have already registered under that. So the government is doing, but there is a lot beyond that. A specialized sector is what the assisted healthcare living, which ASLI and the sector is addressing to it. And as was pointed out by Mr. Mehta, advocacy is part of it, but more important is the regulation part of it. We heard and we know that as an association they're trying to ensure that there is self-regulation, there are certain guidelines, certain self-imposition of regulation. Otherwise, there will be challenges in this sector. There can be, there is always likelihood because it's closely associated with real estate, whether we like it or not. If the Maharashtra government has done something, how does it translate into ensuring that it goes to the targeted intended beneficiaries is something which will continue to be. So as long as the industry regulates, self-regulates, otherwise there will be regulations which may be required. There are a lot of issues. How do you get land at a subsidized rate? How do you waive off the stamp duty? How do you waive off the GST requirement? The healthcare professionals which come in and so on and so forth. One aspect which was talked about was the manpower planning also. There is a large number of population in the country, and as in more than